Playing cricket for India has not only earned me admiration from the people of this great country, but also taught me a lot about life. Be it a test match or one's own health, it's important to know which deliveries to play at and which ones to leave alone. Hello, I am VVS Lakshman and you will be seeing me in a different role today. I am pleased to be here with Dr. Navin, an expert in diabetes and insulin management. Insulin, while important to many diabetes patients, is unfortunately surrounded by misconception which patients can often fall prey to, keeping them away from living the healthiest life they can with diabetes. The purpose of this initiative is to ensure that Indian diabetic patients do not get caught behind by playing an outswinger of misconception and rumors about insulin therapy. Doctor, my first question to you is, patients often feel that insulin injections are going to be painful. Is there any truth about this? How would you reassure a patient of yours who has this fear?
Thank you, Mr. Lakshman. That's a very relevant and the most commonly asked questions by our patients. Whenever we start any patient on insulin, they have the fear of the needles. But I want to tell them, and we also tell to all our patients, that nowadays the needles are very much painless. The newer technology, insulin syringes and the needles have become so much thin and so much smaller in size that the patients don't even feel anything that they are getting an injection. Also, they must follow a few points, like they should select the proper insulin site, they should be changing their needles at regular intervals, and they should keep on rotating the site of injection. So that prevents the pain further.
Thank you. Doctor, my second question is, a patient may be nervous about the social stigma surrounding insulin, like taking an injection in public, or may believe that needing insulin is a personal failure of theirs. What would you tell to such a patient?
Yes, Mr. Lakshman, that's again another very important question. The people do have the fear of taking insulin as they consider it to be a social stigma. But what helps us in overcoming this fear is proper counseling. If we counsel the patients properly regarding the benefits, the mechanism, and all the details about insulin, then they become more confident and they are more ready to take the insulin. Also, we have seen that in such cases, when the patients accept the insulin properly, the medicine works better and the sugars are controlled in a better, effective way.
Thank you. Doctor, my final question to you is, people might believe that needing insulin means they can no longer be independent, eat out, travel, or live alone. Would you say there is any truth to this?
Yeah, that's again a very common myth with the patients have on insulin. Actually, it's on the contrary. The patients today taking insulin, they have a more free and liberal life as they can adjust the timings of the insulin with their meals. They can also carry the insulin with proper cold storage boxes which are very easily widely available. So the patients with insulin, I want to tell you that it is not something which is binding you to your home and you are not able to enjoy your vacation, but you will be more readily and easily able to enjoy your vacations and have a good quality of life. Thank you.
Thank you for your time and your input. Dr. Navin, I'm sure your insights and expertise on insulin therapy will be of tremendous benefit for the millions of diabetic patients living in India. When you're batting with insulin, it's important to avoid the outswinger of misconceptions for a better inning.